Hello, my name is Kevin Zhang. I'll be your nurse for today, just doing some hand hygiene. Can you please tell me your name and date of birth?
Juliet Valdez, January 20, 2004.
Okay, and I'll just confirm that with your wristband. Alright, perfect. And I'll just ask you a few questions before we get started with the assessment. Is that alright with you?
Mm-hmm.
Okay, how are you today?
I'm fine.
How do you like it at the hospital?
It makes me kind of sad.
Why is that?
No one comes to see me.
You can invite your friends to visit you. If you want, I can refer you to a support group with kids around your age at the end. Is that alright with you?
Mm-hmm.
Alright, that's good. And since you are 17, I might have to ask, are you sexually active?
No.
Alright, and before this assessment, we had a hearing test done on you and your results were fine. So
Okay.
that's good. Alright, I'll just take your vital signs real quick. Alright, take your temperature. Alright, nice. It's 97.9. That's good. I'll take your blood pressure. Alright, it's 120/80 and your pulse is 90. So that's normal. And are you feeling any pain today?
No.
No? Alright, that's good. And I just got your respiration when I was doing all this. Your respiration is 16, so that's good. And I'll just check your O2 set, alright? Alright, I'll just hook it up with your finger. Alright, it is 96%, so that's good. And I'll just check your neuro real quick. Can you please tell me where you are right now?
The hospital?
Can you tell me the president?
Biden?
Can you tell me the date?
It's Wednesday.
And why are you here?
I had high fever.
Okay. And I'll just check your extremity strength, alright? Just push up against my resistance. Nice. Don't kick me now. Alright, nice. And I'll check your eyes, alright? So just look straight. Alright. Just follow my pen. Alright, your pupils are equal, reactive to light, and they dilate to light, and they're pretty big and accommodating. Alright, and I'll just check your heart sounds, alright? Okay. Warm this up real quick. Okay. Alright, nice. Your heart sounds are equal and they're normal and there's no murmurs, so that's very good. I'll just check your I'll check your cap refills. Less than 2 seconds, nice. Okay. Now for your okay, less than 2 seconds, that's good. Check your pedal pulses. +2 and normal, that's good. Check this too. +2 normal. Alright. Look for signs of edema. There's no edema, that's good. And your skin color is warm. Your skin color is normal and it's warm. I'm going to check your breath sounds, alright? Can you please sit up for me? Thank you. Just breathe in deep for me. Alright, now you're back. Thank you. Alright, perfect. Your lung sounds, they're clear, and your Your chest is moving equally, bilaterally, so that's good. And tell me, have you been coughing lately?
No.
Any shortness of breath?
No.
Any sputum production?
No.
All right. And I'll just listen to your bowel sounds, all right? Very nice. Bowel sounds times 4, that's good. How's your diet lately? Is it good? Have
Yeah.
you been eating all the hospital food?
Yeah.
That's good. Have you had any trouble swallowing?
No.
No? That's good. And when did you last go to the bathroom to poo?
2 hours ago?
2 hours ago. Was it soft?
Yes.
Was it formed?
Yes.
Was it brown?
Yes.
Did it hurt?
No.
Was there blood?
No.
Okay, that's good. And when did you last go to the bathroom to pee?
An hour ago?
An hour ago. That's good. Was it yellow?
Yes.
Was it clear?
Yes.
That's good. Did it hurt to pee?
No.
Alright, that's good. I'll just check your skin real quick, alright? Alright, your skin is warm. That's good. There's no cuts, abrasions, bruises, alright? And I see you have an IV, so I'm gonna just check the IV site. No redness, no black stuff, no swelling, that's good. I'm gonna just check your line, IV line. Alright, there's no obstructions, air bubbles, that's good. I'll just turn you to your side to check for pressure injuries, alright? Alright, thank you. Okay. Alright, there's no pressure injuries, that's good. So have you been out and about and ambulating?
Yeah, I've been walking around.
That's good, that's very good. It's important for your recovery. And I noticed that you have an IV pole and an IV line, so you are a fall risk. So since you've already been walking around, you know, to call us to help you get up because you're a fall risk. All right. And here's your call light. Just press the button and we'll come help you, assist you to get out of bed, do any other stuff, to go to the bathroom and stuff like that. All right. And do you have any questions for me?
No.
No? All right. Thank you.
Thank you.
And hygiene. Hello, Miss Valdez. How are you? My name is Kevin Zhang, and I'll be your nurse for today. Hand hygiene. I understand you've just gone through childbirth. How are you feeling?
I'm okay.
That's good. How's your daughter?
She's been good.
All right. And how have you been sleeping lately?
Not often.
Oh, why is that?
I have to get up and feed her.
Okay. Well, that is very understandable. Has anyone visited you today?
Yes, my husband.
That's very good to hear. All right. And I'm just going to take your vital signs real quick. Just put this under your tongue. All right. 97.9, that's good. I'll just take your blood pressure. All right. It is 120/80 and your pulse is 80, so that's good. And I'll just take your O2 set. All right. 98%. And I was watching your chest rise. Your respiration rate is 16, so that's good. All right, are you feeling any pain anywhere?
No.
Are you feeling pain in your breasts?
No.
How about your abdomen?
No.
And your vaginal area?
No.
Okay, that's good. Now I'm just going to be performing head to toe on you,
Mm-hmm.
and then the bubble assessment, all right?
Okay.
All right, so can you please tell me where you are right now?
The hospital.
Can you tell me why you're here?
I gave birth.
Okay, can you tell me who's our president?
Biden.
Okay, and can you tell me the date?
It's Wednesday.
All right, I'm just going to assess your extremity strength. Just push up against my resistance. All right, now for your legs. All right, don't kick me now. All right, nice. And I'm just going to check your eyes, all right? So, yes. All right, now follow my pen. Okay, pupils move equally, pupils dilate to light, accommodate. All right, everything is good, all right? And now I'm going to listen to your chest. I mean your heart. Just warm this up. Just under here real quick. All right. Heart sounds are good. There's no murmurs. Everything is normal. I'll just check your cap refills. All right, less than 2 seconds. Okay. Less than 2 seconds. That's good. Now for your pedal. All right, less than 2 seconds. Now for your pedal pulses. +2 and normal. All right. Just check these two. +2 and normal. That's good. And your skin is warm. The color is normal. That's good. And I'm seeing that there's no edema, so that is good. All right, I'm going to just check your breath sounds. All right. Just breathe in deep for me. Now for your back, just move your hair real quick. Thank you. All right. Breath sounds are equal, and your chest was moving equally bilaterally, and breath sounds were clear, so that's good. Have you been coughing recently?
No.
No? All right. Have you had any sputum?
No.
Any shortness of breath?
No.
All right, I'm just going to listen to your bowel sounds, all right?
Okay.
Okay. All right, bowel sounds ×4. How have you been eating lately?
I've been eating pretty good.
Any difficulty swallowing?
No.
All right, when was your last bowel movement?
3 hours ago.
3 hours ago, okay. Was it soft formed brown?
Yes.
Okay, did it hurt?
No. Or a little bit because of the episiotomy.
Okay, and when was the last time you urinated?
An hour ago.
Okay, so your bladder's empty before we did this assessment, right?
Yes.
Okay, that's good. And did it hurt?
Only a little bit because I had the peri bottle.
Okay. Was it yellow and clear?
Yes.
Did it smell? Any foul smells?
No.
All right. And have you ever had a Foley catheter?
No.
Okay. And now I'm just going to assess your skin for any cuts and abrasions. Now I'm going to roll you over. Just look for pressure injuries. Look at your heels. No? All right, that's good. And have you been ambulating?
Yes.
That's good. I see that you have an IV. I just checked the IV site. It is no redness, no bruising, no black stuff. That's good. Just check this. Eye trace. All right, no obstruction, so that's good. All right, and you are a fall risk because of the IV pull, so definitely bring your call bell when you wanna get up and do anything. All right, and now I'm going to perform the bubble assessment on you. I'm going to palpate your breasts. All right. Okay. All right. There's no hardness. There's no occlusion, so that's good. Are your breasts tender?
A bit from feeding.
Okay. And I see that your nipples, they're normal. There's no cracking. There's no redness. It looks fine. All right. And I'm going to check your uterus, and because you just emptied your bladder, you should be good. All right. Support the uterus. All right. Just pressing down. Okay. Your uterus is firm, so that's good. All right. And now your bowels. You mentioned that you had a fine bowel movement, so that's good. And you said that it did hurt a bit because of the episiotomy, but it wasn't anything. How would you rate that pain out from 1 out of 10?
Probably like a 3.
Okay. Do you need any pain medication for it?
I don't think I do.
All right. And how is your? We talked about your bladder at first. How have you been peeing?
I've been peeing well.
Okay, that's good. And no burning, right? Or just a little?
Yeah.
Yeah. All right, so that's good. All right, and I'm just going to document all of that. All right, and now I'm going to turn you over to your side to look at your lochia. Just like that. All right. All right. There's a scant amount, and it's a little blood. So, how many have you been using?
Probably like 2 or 3 pounds.
All right. That's good. All right. I just change it. Nice. We changed it. All right. And now for episiotomy, if you would just make your legs into a frog-leg position. Thanks. All right. I'm just going to assess the redness. There's no redness. Look at the staples. There's no swelling. There's no redness. There's no bruising. That's good. The staples are intact. There's no discharge. That's good. All right, I'm going to measure it. Measure the laceration. All right, it's 1/2 inch. So there's no deviation from when the doctor cut it. So that's good. No redness, anything. Do you have hemorrhoids?
No.
No? Okay, that's good. All right. And I'm going to educate you on preeclampsia for your safety. Preeclampsia is a blood pressure condition that can lead to seizures, and signs and symptoms of preeclampsia include vision changes, swelling in extremities, high blood pressure, and protein in your urine, and also hemorrhaging and bleeding. Hemorrhaging is bleeding like a copious amount, and signs and symptoms is like bleeding a lot, like a lot. And don't like pull out the blood clots from the pad. All right. And do you have any questions for me?
No.
No. All right. Here's your call bell if you need it. I'll put 2 guardrails up. All right. And call us if you need anything. All right. All right. Thank you, Ms. Valdez.
Thank you.
Hand hygiene. Hello, Miss Hopkins. My name is Kevin, and I'll be your nurse for today. I'll just do hand hygiene. All right. And can you please tell me your name and date of birth? All right. And I'll just confirm that with your wristband. Okay, perfect. Now, I understand that you just gave childbirth and your baby looks wonderful. He looks fantastic, and I can see that his behavior is alert. All right, so I'm just gonna put some gloves on. All right, gloves are on. And now I'm going to just weigh him. Now I'll support the neck. All right, I have weighed him, and he is 18 inches and 6.25 ounces, so that's good. I'm going to measure his head circumference. All right. He has a normal head size of 33 centimeters, which is pretty good. Now I'm going to take his vital signs. I'm going to take his temperature. Perfect. 98, so that's pretty good. I'm going to take his respiratory rate. Alright, he's breathing normally. And his respiratory rate is 57, so that's good. And I'm going to take his blood pressure. Alright, so his blood pressure is 90/45, and his heart rate is also 120. And now I'm going to take his pulse rate. Oh, his pulse rate is 120, and I can see that he's not in pain because there's no indication of crying or any indication of pain. Alright, so I'm just going to check his skin color. His skin is warm, nice, soft. There's no yellowing, so there's no jaundice of his skin. And his mucous membranes are pink. And I'm going to check for this, let's see, I'm going to flip him over a bit. Mongolian spawn butt. And I can see that he has dry skin, no ecchymosis, no rash. That's good. And he has lanugo on his back and arms. Now I'm going to palpate his head. Alright, just feeling for the fontanelles. Alright, I can see that his fontanelles are not sunken in, so that means he's not dehydrated, so that's good. His fontanelles are still open, but it'll close as he gets older, so that's good. And it's not bulging. Now I'm going to check his eyes, Perla. Alright, his eyes are reactive to light, and they follow my pen, so that's good. Now, his neck is a wonderful neck. And his ears, I'm checking his ears. They are not lower than his eyes, so that's a good sign. Alright, now I'm going to just, for your child's safety, I'm going to discard my gloves and then do hand hygiene. And then I just put some new gloves on. And now I'm going to check his cleft palate. Alright? Nice. It is wonderful. And while I'm doing this, I'm checking for his sucking reflex. So your child is sucking my fingers, so that's good that he has that reflex. And then I'm going to take it out, and then I'm going to check the side of his face to see if he faces towards me, the root reflex. Alright, your child is facing towards my stroking of his face, so that's good. Alright, and I'm going to check his extremities, his muscle tone. Check. He moves well. Child is very adorable, miss. Alright, and now I'm going to check his Babinski reflex. Now I'm going to stroke the bottom of his feet. Alright, his feet have curled in, so that's good that he has that reflex. And I'm going to check your son's grasping reflex. So I'm going to put my finger into his palms. Nice, he's grasping it. This is my favorite part about a child. It's so cute when they grasp your finger. Alright, and now I am going to check your son's heart. I'm going to listen to his heart. I'm going to listen to the left nipple area for heart sounds. I'm going to warm up my stethoscope real quick. Alright, nice. Alright. Wait. This side. For a younger kid. Alright. Alright. There are no murmurs. Your son has a healthy heart. And his heart is beating very fast. And I'm going to check his cap refills. Nice, less than 2. And there's no signs of edema. Alright. Just going to check his pulses. Alright, they're normal. Alright, now I'm going to check for his respiratory, his breath sounds. Alright, I'm going to check his, breathe in deep for me, alright? Alright, buddy? Alright. Please, mother, I want to check his lung sounds from the back. If you just help me up, help me with your son. All right, perfect. Gotta remember to support the neck. Deep breaths, my friend. All right. Your son has healthy lungs and he breathes well, so that's good. And his chest is moving equally, bilaterally. Has your baby been coughing, ma'am? No? Okay, that's good. Any shortness of breath? No? All right. All right, I'm going to check your son's bowel sounds now. Has he been eating good? Has he been drinking milk good? All right, good. Bowel sounds in all 4 quadrants, so that's good. And I can see that his nipples are even. There's no discharge. I can see his belly button is normal. His femoral pulse. Just gonna take the femoral pulse. All right. Okay, it's normal. Now I can see that his abdomen is symmetrical. He has a flat umbilicus, and I'm going to check your son's anus just to see if it is normal. All right, I'll just turn your son to the side. Check his anus. All right, your son's anus is normal. All right, so that's good. And has he been urinating well? Okay, that's good. All right, now I'm going to check his testicles, and I can see that his testicles have not dropped yet, but they should drop in a couple of days, so that's good. And you have a healthy son. I'm going to check his clavicles to see if it's all right. His clavicles aren't broken. He has 10 fingers and toes, and I'm going to check his back. All right, if you would just help me. Put on his back. All right, son. Just okay. Okay, I can see that he has a straight spine and it's symmetrical, so that's good. All right, I'll just flip him back. Please, mother, if you will help me to support the son. All right, nice. Okay, so thank you. Thank you, Ms. Hopkins. Thank you. Do you have any questions for me? No? Okay. I'll just take off my gloves, do hand hygiene. All right. And if you need anything, here's your call bell. And I'll just put some guardrails up. So I'll put 2 guardrails up. No, 3. 1, 2, and 3. All right. Thank you. Hand hygiene.